So what will you see that the minor dura in your apical area will be slightly widened. Okay, now there will be PDL widening and you will lose the continuity of your lamina dura. So now when I say lamina, you all know what is a lamina dura? पढ़ा है ना? OMR में पढ़ा है ना? क्या पढ़ा है? What is lamina dura? वो तो मेडिसिन में क्या पढ़ा? रेडियोलॉजी में पढ़ते हैं। कार्डियो में क्या पढ़ते हैं? वाइड एंड पैरो, पॉकेट्स। OMR करते हैं। चलो lamina dura क्या होती है? This lining of your PDL in radiograph is known as your lamina dura. Okay, so now when you see if your tooth is healthy, you will see that your lamina dura would be continuous around the tooth. Now when there is some kind of inflammation, what will happen? There will be a loss in the continuity of your lamina dura. So this is the main method of how do you diagnose. पहले आपने clinically examine कर लिया, patient के symptoms देख लिए, okay, then you see your radiographic, you have to go ahead with your radiographic investigation. So in that you will see that there will be a loss of continuity of the lamina dura and there will be some PDL widening. ठीक है? Are you all with me?
Yes, ma'am.
Are you all able to understand? ठीक है? After that we will also do some kind of pulse sensibility test. पढ़ा है आपने जब pulpal diseases पढ़ा है तो pulse sensibility test पढ़ा है उसमें आपने? So what are the different pulse sensibility tests that you do? Thermal test, you do electric tests. Okay, thermal test में आप कौन-कौन से करते हो? Cold test and heat test. और electric pulse test में आप EPT करोगे. ठीक है? So when you do so this in case of a non-vital tooth, when the patient has symptomatic apical periodontitis, you will not get a response under these tests. Okay? Or you may get a delayed response. How do we do these tests? We will be discussing when we move to diagnosis wala chapter. Okay, because that has not been covered for you. So once we finish with your pulpal diseases, periapical disease, after that we will start with diagnostic methods. Okay, so you will not get a response. So we have studied what is apical periodontitis, what are the symptoms of the patient, how do you diagnose it. Okay, then we come to differential diagnosis. Now what is differential diagnosis? Symptoms. जो symptoms हैं, एक can mimic two types of diseases, so you need to identify which is the other disease that can be there. So it can be symptomatic apical, asymptomatic apical, symptomatic apical periodontitis, or it can be your symptomatic apical periodontitis can either be acute alveolar abscess also. Now acute alveolar abscess we will be discussing further. On bacteriological examinations, sometimes it may be sterile because there may not be any infection. It can be because of some kind of trauma or irritation that the apical periodontitis has happened. So there will not be any bacteria which will be present there. Okay, and also sometimes if there is caries which has caused your apical periodontitis, you can find some kind of bacteria or toxins to be present. Okay, so histopathological examination में now you know it is symptomatic apical periodontitis. That means it is happening for the first time. Mostly it is acute. Okay, so acute inflammation में आपके कौन से cells रहेंगे? Polymorphonucleases रहेंगे. So your blood vessels will be dilated because it is inflammation. You will see all the signs of inflammation there. Blood vessels will be dilated. There will be PMH which will be present. There will be accumulation of your serous exudates. Okay, and if there is some kind of irritation that continues, the body may show response of some kind of osteoclastic activity there. Fine. So the main treatment here is to remove the causative agent. So now if I am having apical periodontitis because of some abnormal crown, I have to change the crown. Fine. If I am having apical periodontitis because of some kind of a high point in my filling, I need to relieve that. If it is because of caries, I have to initiate root canal therapy. So you need to remove your causative agent, then only the symptoms will go. It is not that if you just started with your root canal therapy and you have not corrected the crown, the patient will never be comfortable. So whenever you do any treatment, you first have to remove the causative agent. Then only your treatment, whatever later on you do, will be successful. Okay? So now we come to acute alveolar abscess. So now when you remember the chart, symptomatic apical periodontitis, the next one was acute alveolar abscess. Now the apical periodontitis has what is it? It is just a cavity which is filled with some kind of pus there, okay, or a fluid which is there. That is called as an abscess. So similar thing happens here also. Okay. So acute alveolar abscess is acute inflammatory reaction to pulpal infection and necrosis. Now you see, your apical periodontitis was just inflammation. Okay, fine. There was no not infection there. In acute alveolar abscess, it is said to be as pulpal infection and necrosis that causes an inflammatory reaction. So there is a difference between the two. Understood? Are you all with me? Okay. So acute inflammatory reaction to the pulpal infection or necrosis characterized by rapid onset, spontaneous pain, tenderness of the tooth to pressure, pus formation and eventually swelling of the associated tissues. So हमारे दांत में infection था, necrosis था, उसकी वजह से मेरे apical area में जो inflammation होगा, that is called as acute alveolar abscess. Now since it is an abscess and it is acute, the symptoms will be very exaggerated. Okay, the patient will have lot of pain, fine. There may be swelling which will develop later. Okay, there will be an extreme tenderness of the pain and the nature of the pain will be spontaneous. So these are the key words that you need to remember. That means it will be a rapid onset, spontaneous pain, there will be tenderness of the tooth. Obviously if there is some kind of an abscess, this is my tooth, there is abscess, the moment I touch it, there will be a pressure that will be developed here. Already there is a pressure here, fine, that is causing the tooth to be always sore. Okay? So there will be increased response. So now what are the causes? So there is infection which is coming from the pulp. So my cause here will either be bacterial invasion of the dead pulp or trauma. So now trauma happened, it made my tooth dead and that dead tooth caused my acute alveolar abscess. Understood? Suppose if you were in a fighting, आपको जोर से दांत में चोट लगी, गगन का भी दांत टूटा, okay, आपको स्विमिंग करते हुए चोट लगी, इसका दांत you have placed it back, Neha has placed it back. But in case if the trauma was very strong, right now he did not come to know. Gradually we have to keep the tooth under follow-up. In case the tooth starts to get discolored, that means the tooth is getting dead inside. Sometimes it can cause an acute alveolar abscess. Okay? So there is a trauma which made your tooth dead. That can also cause acute alveolar abscess, or there is a decay that has made your tooth dead, which is causing acute alveolar abscess. Is everybody understanding? Okay? So then what is happening here? No drainage is possible due to the closed nature of the pulp and it drains through your apical foramen. Okay? So now you know that the tooth is a closed system. There is no place जहाँ से हमारा infection निकलेगा. And whenever you see when you see surgery also, you will see a sinus formation. That means the pus will always drain through the path of least resistance. Okay? So now in a tooth, which is the path of least resistance, your apical foramen. Okay? So there will be pressure build up inside. So the moment you will initiate your root canal treatment, there will be pus that will come through your canal. Okay? That means there is a pus which is getting filled up through your apical foramen into your canal, and the moment you initiate the treatment, there will be pus discharge. Understood? So that is your acute alveolar abscess. Now sometimes when you do not get it treated, there is no initial swelling there. Gradually the patient may develop some kind of swelling in that area, which will be very distended like this. So there can be an extraoral swelling which can be seen here, or an intraoral swelling. So this will be a very tense tissue which will be totally stretched. Moment you prick on it, there will be pus discharge. So this does not happen in initial cases, but if the abscess stays for a long time, it can give rise to your extraoral or intraoral swelling. Okay? So what are the symptoms here? Tenderness to percussion, the tooth feels to be extruded out, there is throbbing pain, there can be swelling which is present over the tissues, mobility can be present, okay, because after the apical area mein the infection is there is inflammation, so there is some kind of mobility that develops. The tooth slightly is extruded in the socket and it is mobile, okay, and the patient may also present with some kind of systemic symptoms. Now what are the systemic symptoms? If you have some kind of boil in your body, sometimes you can develop fever also. So similarly in this condition also, if the symptoms or abscesses continue to be there, the body will give rise to some kind of systemic symptoms, as the patient may be febrile as well. Understood? So you should know the symptoms for the acute annular abscess. Is everybody able to understand right now? So now what is the diagnosis? So the diagnosis will be based upon the history. What is the patient having? What type of pain the patient is having? Since when is the patient having the pain? Is the patient able to localize the tooth that is giving the trouble to him? What type of pain is there? All these things we have to take. The history has to be taken. After that we have to do a radiographic examination. So when you do a radiographic examination, in the projector you are not able to see. So in your apical periodontitis, we just saw that there is some kind of loss in the continuity of your lamina. Okay. So now suppose if this is my tooth, suppose this is my premolar. ठीक है, यहाँ पे मेरी जो continuity है वो यहाँ पे it was lost. But in abscess there will be a radiolucency of a larger dimension that will develop in my acute annular abscess. Sometimes there may not be any radiolucency. It's a very early abscess. Just suppose the abscess has just formed in a few days back. There may not be any radiolucency. But if the abscess has been there for a very long time, it can give rise to a radiolucency as well. Because for radiolucency to develop, there has to be some kind of austenitic activity to occur. Okay, there has to be bone resorption to happen. Then only there will be some kind of radiographic changes. So for the radiographic changes to set in, the lesion has to be present for a long time. Okay, so differential diagnosis is periodontal abscess. Now can somebody tell me what is a periodontal abscess? अभी हमने पढ़ा apical abscess. That means the abscess is present near your apical foramen. Now what is periodontal abscess? Abscess which is present all along the surface. Okay. So suppose if we are talking about a multi-toothed tooth. Okay. So that you can see it in this diagram. So if you see a multi-toothed tooth, sometimes there can be a thing that because the infection went through the gingival sulcus, it caused an abscess there. So that is a periodontal abscess. In our apical abscess, what will happen? The infection will go from your root canal and then cause infection here. Okay? So the etiology causing the abscess is different. One is periodontial, the other is your apical abscess. So now how do we differentiate between the two? So normally when you have a periodontal abscess, the tooth normally will not have any kind of decay there. When you do pulp sensibility test, you will get a normal response. That means क्या है, मेरा दांत अच्छा है, बाकी के चारों तरफ के पेरिडोन्शियम में प्रॉब्लम है. That is a periodontal abscess. Now if you have an apical abscess, there will be no response when you do your pulp sensibility test. So this is the main method of differentiating between your acute apical abscess and acute periodontal abscess. Is everybody able to understand? Okay? Are you all understanding? Are you all with me? So when we see a bacteriological examination in periodontitis, we did not have any kind of bacteria involved in it. Here, because there is infection, we will see bacteria. So we will see strepto, staph, which will be present, or it can be sterile when there is already a continuous drainage from the canal. Then there will be sterile liquid present there. So when you see a histological examination, since it is an acute abscess, you will see polymorphoneutrophils. Okay, when we study chronic abscess, there we will see that your macrophages and monocytes will predominate. In this particular condition, you will have PMNs to be present there. There will be a rapid accumulation of the exudate, and the root canal may be devoid of tissues or show clumps of microorganisms and debris. And in later stages, if it continues to happen, there will be mononuclear cells. So now, since why do we have this root canal devoid of tissue? Because my pulp is already necrosed. There is nothing there. Okay. So my root canal will not show any kind of tissues there. There will be dead tissues with some bacterial accumulations there. If I see the examination of the exudate, there will be streptostaph infections which will be present there, and polymorphoneutrophils will be present. Did you understand the difference between your apical periodontitis, which is just an inflammation, and abscess, which is an infection? Okay? So treatment is basically establishment of the drainage. So how do you establish initiate the root canal treatment, we will initiate and we will see that the symptoms of the patient for the patient will subside. Okay. Sometimes when there is systemic involvement, then there may be a need for you all to administer antibiotics as well. Otherwise, there is no need of giving any antibiotics to the patient till the time you see any systemic symptoms. It is not that if you are doing root canal treatment, you have to give antibiotics to the patient. Only painkillers may be needed if the patient experiences some pain which can be on SOS basis. Okay? Otherwise, you do not need to administer any antibiotics to the patient. Understood? Now coming to Phoenix abscess. Okay, so now we studied symptomatic apical periodontitis, then we studied about acute apical abscess. Now we studied about Phoenix abscess. So Phoenix abscess क्या है? Acute inflammatory reaction superimposed on an existing asymptomatic apical periodontitis. Now what is that? Your patient had apical periodontitis, but it was not giving symptoms. That means it was an asymptomatic apical periodontitis. Now suddenly that patient infection which was in a dormant condition becomes active. That is called as a Phoenix abscess. Okay? So now how will the patient present to you is, patient will come and say मुझे 4 साल पहले दर्द हुआ था, फिर बिल्कुल दर्द नहीं हुआ, लेकिन 2 दिन से बहुत सीवियर पेन. Okay, so 4 years back he had symptomatic apical periodontitis, but then the infection reduced, the grade of the infection reduced, it became chronic infection. Okay, but suddenly there was some kind of irritation, okay, or maybe some kind of reduction in the immunity of the patient that resulted in an exaggeration of the response. So this is called as a Phoenix abscess. Very important for a 2-mark and a 4-mark question. Okay, so what is a Phoenix abscess? So basically it is an acute inflammatory reaction superimposed on an existing asymptomatic apical periodontitis. समझ आया? Existing था asymptomatic apical periodontitis, मतलब inflammation of periodontium was there, but patient was not aware of it. Okay, but suddenly there is a superimposition of that infection on this infection, and it causes symptoms of the patient. So noxious stimuli may cause an acute reaction. The tooth will be tender to percussion, and mucosa around the tooth may be red or it may be painful on palpation. Okay? So for all kind of periradicular diseases, normally the symptoms that you would see would be of your tenderness to percussion, okay, and pain on palpation of the adjacent mucosa. How do you diagnose it? May occur in a already initiated root canal treatment, okay, or you can see, you will be able to diagnose it with a non-responsive pulp testing. That means there will be no response when you do the pulp testing for the patient. Okay, on rare occasions there may be a response if it is a multi-rooted tooth. If it's a multi-rooted, suppose it's a maxillary molar, my mesobuccal and distobuccal are non-vital, or my palatal and mesobuccal are non-vital, but my distal is still vital, then it may give some kind of response. So rarely you may get a response, but when you take history from the patient, you will be able to diagnose that it is a Phoenix abscess. Okay. So now bacteriologically it will be sterile because it's an inflammation. Histologically you may see some kind of liquefaction necrosis. You are disintegrating PMNs because it is an acute reaction. Also it is a chronic condition. You may see macrophages, plasma cells and lymphocytes. So now you see how the histological examination changes. When it is chronic, there will be your lymphocytes, monocytes which is present there, and your plasma cells. But if it is an acute infection, there will be PMNs there. So now since it is an acute condition which is occurring in already a chronic condition, you will see both types of cells. Okay, so it's an acute condition which is occurring in already a chronic condition. So we will see both type of cells. We will be seeing disintegrated PMNs and also macrophages, plasma cells and lymphocytes. Okay, so that is Phoenix abscess. Fine. So now what will be the treatment? In case you have not started the root canal treatment, you need to initiate root canal treatment. Fine. In case the root canal treatment is already initiated, so you need to intervene, and maybe this would be like an emergency visit for the patient, where you need to see the patient again in between the appointments. Suppose I did a treatment today for you, वापस आता है. If I see the patient again, so that can be a in between treatment. ठीक है. So now we have covered about your symptomatic apical periodontitis, acute alveolar abscess and phoenix abscess. So these are all the symptomatic conditions that we have covered as of now. Now we move on to the next part of the classification, which is your asymptomatic. ठीक है. अभी तक का समझ आया? Okay. So can you all tell me what all things did we study? Starting with symptomatic apical periodontitis, acute alveolar abscess, phoenix abscess. Can somebody tell me what is a phoenix abscess? Examination of a what is symptomatic apical periodontitis? What will be the symptoms of the patient? One person. पेन का होगा, बाइटिंग में, कंप्रेशन में पेन होगा, ठीक है, and the patient may feel that the tooth may be exploded also, ठीक है. In your absence, there may be chances that there may be slight mobility. So when you initiate the root canal treatment, if mobility is present, and if you initiate the root canal treatment, the mobility will reduce by the next appointment, okay, because the mobility was just because of the accumulation of the pus. So moment the pus goes away, the mobility reduces. Because sometimes the patient may come to the department with grade 2 mobility also. You would think that RCT would not help, but in such conditions, if you initiate the root canal treatment, next appointment when the patient comes, it is less than grade 1 also. Okay. So now we come to asymptomatic periradicular diseases, right? So asymptomatic periradicular diseases में सबसे पहले है asymptomatic apical periodontitis. Is it okay if I continue? चलेगा ना इसमें मत टाइम. So we finish this. ठीक है. Asymptomatic apical periodontitis में क्या है? Symptomless sequelae of symptomatic apical periodontitis. मतलब पहले symptomatic था patient, but now the symptoms have gone. Fine. So patient, so how will you come to know? You will be able to diagnose it only during the regular radiograph. The patient has come to you for a regular checkup. Then only you see that there may be some kind of infection that will take a radiograph. Then you will identify that there is some kind of asymptomatic apical periodontitis. Otherwise, the patient will not come to you with the problem. ठीक है, because it is an asymptomatic condition. ठीक है, characterized radiographically by periradicular radiolucent changes and histologically by the lesion that will be dominated by macrophages, lymphocytes, and plasma cells. So now the histological picture, the symptoms of the patient, everything will change. What was there was symptomatic will not happen here. Patient has not come to you